What pandemic disease affects the lungs, has killed thousands, and has a primary symptom of coughing? You may be thinking, that sounds exactly like COVID-19. Well, you would be correct, but the current pandemic is only one of the many respiratory diseases that could be lingering in the air around us without us even knowing. Tuberculosis is one of these such diseases that has actually been plaguing the world for centuries. I've always been intrigued by different diseases, but tuberculosis in particular has always caught my interest. After reading numerous books, medical journals, and other types of research, I'm going to tell you just how tuberculosis is contracted, how it affects an infected person's body, and how it is treated. First, let's take a look at where it all begins, when a person comes in contact with tuberculosis. Tuberculosis is an infectious disease that is easily transmitted between individuals. When a person coughs, sneezes, or participates in any activity such as singing or talking, they emit bacteria in the form of small droplets. This bacteria can pass to nearby individuals or linger in the air and wait for a healthy individual to come along. According to Irene Hsu, author for Pharmaceutical and General Health magazine, The American Druggist, a person becomes infected with tuberculosis through inhalation of the bacteria Mycobacterium tuberculosis. Once this bacteria enters the body, it begins to head towards the lungs. Once this occurs, the person has been successfully infected with tuberculosis and can now transmit it to others. Now that we know how tuberculosis is contracted, let's look at how it affects the body. Individuals who are infected can exhibit a variety of visual symptoms. But before these symptoms begin to show, first the bacteria must begin its work in the lungs. Once the Mycobacterium tuberculosis enters the respiratory system, it begins eating away at lung tissue. After this occurs, the person begins to show more visual symptoms of tuberculosis. Most people know the most common symptom for tuberculosis, which is coughing, but there are many more other physical effects. Some can experience fatigue, fever, sweats, weight loss, and chest pain. Even the cough has more serious implications. Individuals will cough up mucus and blood due to the bacteria eating away at the lung tissue. Even after individuals are cured, they can start experiencing long-term effects. According to Thomas Lynch, who specializes in biopharmaceuticals and medical clinical trials, after being cured, individuals can still develop a chronic cough due to damage in the lungs as well as frequent chest infections. So far, we have learned how tuberculosis is contracted and how it affects an infected person's body. But how is it treated? After many years of research and deaths, researchers were finally able to find an effective treatment for tuberculosis. The most common treatment for tuberculosis is a series of antibiotic medications. According to the National Health Agency, the CDC, the four most common types of antibiotics used is isoniazid, rifampin, ethambutol, and pyrazinamide. These four medications are taken every day for the first 2 months in what is called the intensive phase. After this intensive phase, isoniazid and rifampin is taken every day for the next 4 to 7 months in what is called the continuation phase. The CDC further explains, as long as individuals follow this regimen, they have a good chance of becoming cured of TB. This is especially shown in research by the World Health Organization, which said that 36 million individuals were completely cured of tuberculosis over the last 15 years due to following this exact regimen. As you can see, the journey from contracting TB to treating it is a long and bumpy one. First, individuals must come in contact and inhale the Mycobacterium tuberculosis. Next, the bacteria begins eating away at their lung tissue, and individuals start showing the most common symptoms of tuberculosis. Lastly, the individuals must be treated with a strict regime of antibiotic medications. After learning so much about tuberculosis, it makes one really begin to wonder, what exactly is lingering in the air around us?